Good morning. I'm Dr. Teresa. I'm an ENT surgeon, and I have the privilege and the honor to introduce you Professor Marissa Barrera and Professor Biber that work on the NMES project for 2 decades now. Please tell us something about yourself first.
Well, thank you for having us. My name is Professor Marissa Barrera, and I am a professor of acquired motor speech and swallowing disorders. And I am proud to be the National Director of Clinical Education and Research for Guardian Therapy. I specialize in neurological diseases in New York City.
And I'm Teresa Biber. I'm the International Director of Clinical Education and Research for Guardian Therapy and the developer of the Biber protocol, which uses NMES in the treatment of patients for dysphagia and voice disorders. My background is particularly with adults with diseases affecting their ability to swallow and speak, and in particularly in head and neck cancer patients and post-radiation dysphagia.
Our first question is, what is the main concept of the NMES treatment?
What NMES is an acronym, and it stands for Neuromuscular Electrical Stimulation. And what neuromuscular electrical stimulation is, it provides small electrical impulses that are applied externally, so to the skin somewhere, to actually evoke an action potential, or in layman's terms, cause the muscle to move. And you do that by activating the nerves. The nerves turn and tell the muscle to move. And the beautiful thing about this program is that you can get the muscle to move better than the patient can move on their own. So if you have a patient that has an impairment of the muscle or the nerve, you can actually activate those nerves and get the muscle to move.
And what are the applications of this innovative technique in dysphagia?
Well, for dysphagia, the technique is quite helpful as it can be applied to a specific area called the submental region, or more specifically, the suprahyoid muscles. When these muscles are activated by applying 2 electrodes, it can help strengthen the muscles responsible for the elevation of the larynx, which in turn helps our patient swallow safely and more efficiently. There's also an application for the muscles of the face, which often plays an important role in the chewing and manipulation of the bolus necessary for swallowing.
I also heard that there is a possible application of the NMES in facial paralysis. Since you can apply the electrodes in the mouth, then what can we do in cases of facial palsy?
Well, in the same way, if you know what muscles you're stimulating and why, you can use this technique particularly for any muscle in the body. But our specialty, of course, is for swallowing problems, facial palsy, voice problems. So absolutely, a patient without any specific swallowing problems but has a facial paralysis, you apply the electrodes in the area of interest, and then you're able to evoke or to cause those muscles to contract and move. And one of the most important characteristics of this technique is it is not a passive technique. It is an active technique. So the patient is an active participant, not a passive recipient. So we are doing the job of actually activating the muscles, causing them to move, and then of course performing a variety of exercises or task-specific exercises that will then tell the brain that this is what's supposed to occur during this time. So for example, in facial paralysis, if the face is drooped, you activate the muscles and you have the patient smile at the same time. The message gets sent to the brain and you're able to reorganize the cortex.
The use of the NMES does not depend on the patient's cooperation.
Well, again, one of the beautiful things about this technique, if you would agree, Marissa,
Yes,
is that you can actually use this with patients who have difficulty cooperating for a variety of reasons. Perhaps they don't comprehend what's happening, or perhaps they're actually unable to do the tasks. So because you're able to actually activate the muscles that are involved in the swallowing process and then stimulate swallowing, you can see a better outcome for a patient that would not have been able to participate in a more standard therapeutic regimen. Would you agree, Marissa?
I agree. And furthermore, I think it's important to note, because the application is so specific to the muscles and the nerves of interest, you can apply it to a wide variety of clinical populations, but age populations as well. both infants and children who are unable to participate in cognitive tasks because simply of their brain maturation, they can also benefit from this therapy, as well as older adults who might have dementia or other cognitive deficits. So I concur 100%.
It sounds as a great weapon in our armamentarium. What are the studies supporting your work? Is NMES plus conventional therapies better than conventional therapies alone?
Absolutely. There are more than 180 published research studies that looks at the application of neuromuscular electrical stimulation for a variety of conditions: facial paralysis, dysphonia, swallowing disorders, as well as dysarthria. Specifically for the application of swallowing, one of our most powerful research studies combines the use of NMES and traditional swallowing exercise to reorganize and create cortical reorganization, and this study was completed by a Korean physician by the name of Oh in 2007, and it really supports the combination of the modality of electrical stimulation paired with therapeutic exercise. It's quite amazing.
That's perfect news. That's music to my ears. But who are the patients that are eligible for NMES?
Well, actually, the umbrella is quite broad. Dysphagia or dysphonia or facial paralysis can be caused by a variety of metabolic disorders, structural lesions, central nervous system problems, head and neck cancer, multiple sclerosis, Parkinson's disease, ALS. So you have this broad category of diseases that can cause these specific disorders of swallowing, voicing, facial paralysis. So the disease isn't so much the indicator for the NMES, it's more the patient's presentation of the symptoms. And if the patient presents with symptoms that would indicate that they would benefit from stimulating those muscles to move better, then most likely they're a candidate. There's actually a very, very small portion of people who would not be candidates for, but the vast majority of the patients, because it's a safe treatment, because it's a non-invasive treatment, and because you have the skill, if you are trained, in being able to modify and manipulate the parameters, you can make it a very comfortable treatment for any patient. So really there's very few patients that would not be candidates for this therapy.
Are there any contraindications to the method?
That's an excellent question. The use of neuromuscular electrical stimulation is safe with a majority of clinical populations. The only populations we should take special consideration for are those individuals who have a defibrillator and those individuals who may have a vagal nerve stimulator. But otherwise, we work with our patients case by case to make sure that they are safe for the modality.
Can we use this device in outpatients, patients that have been discharged from the rehabilitation center for long term?
Right, absolutely. So again, one of the other beauties about this particular protocol is, although there is a specific skill that's required in the clinician who is implementing the treatment, the patients or caregivers themselves can also be trained to take the treatment home with them. So they can either come back for subsequent sessions with the skilled therapist, or if perchance they're having to travel away from this region and back to their home country or their home territory, and feel that there is still a need for the therapy to exist, they can actually take the treatment with them, be trained, and continue it at home. And we'll provide the support and the resources for them to be able to do that.
I agree. Some of our most successful cases have been individuals seen in an outpatient setting and then continued the therapy at home in collaboration with the speech pathology department.
Thank you for having you here today. It's been very nice and really creative discussion, and I think that all your information will have soon important clinical applications in the Greek practice.
Well, thank you. It's been an absolute honor and privilege to be here today.
And thank you very much. Again, we love what we do, and we love being here to help all of the people in Greece.